Most people don't realize, but back injuries are one of the easiest workers' compensation cases to mess up. If you make the wrong move early on, the insurance company will use that against you to deny your case or cut your benefits off or to reduce your benefits significantly. So today, we're going to talk about why back injuries get attacked so aggressively, the early mistakes that destroy these cases, and what you need to know to maximize your settlement. If you hurt your back at work, this is not a video you want to miss. Why are back injuries so hard to win in workers' compensation? Back injuries are pretty much the number one case insurance companies fight. They deny these cases more than almost any other injury case for a lot of different reasons. They claim it's age, wear and tear, degeneration, even when the job clearly made those injuries worse. So you could have had prior back problems, you could have had a pre-existing condition, a prior injury, something, and your job clearly caused a worsening condition, but they're going to give you a hard time. This is the first thing they argue every time. You know that your pain is real. You know you're having problems, but the system doesn't necessarily treat it that way. The way people feel pain is different one person to the next. Pain is subjective, which means it's just your personal experience. But here in New York, judges and insurance companies, they really want objective proof of your injury and your disability. Irrefutable, not based on opinion, based on fact. And what's the problem there? Your MRIs might not always match your pain. You can have a bad MRI finding with positive findings and no pain, and you can have horrible pain with a relatively normal MRI. Insurance use these mismatches and these issues to say that nothing's wrong, or you're faking it, or it's not that big a deal. And the burden of proof is higher when there are older back problems, even minor ones. When you have to show that your current level of disability and your current injury is not directly attributable, at least in major part, to an old injury, an old problem, they're going to give you a hard time. Even if that old pre-existing condition was a minor condition, even if you had gone back to full duty for an extended period of time, insurance companies are going to go ahead and claim that your current symptoms are 100% due to the old injury, the pre-existing condition. They're going to try to dump it all off on an older accident so they don't get left holding the bag of your treatment and your lost time. It's a major problem that's very specific to back cases. IME doctors tend to be the most biased when it comes to back injuries. Their exams are usually very short, usually 10 to 15 minutes. If you're lucky, I saw one last week that was 3 minutes long. It's insulting. A lot of times the IMEs, doctors don't report what you told them. There have been times where I'll say, doctor, did you ask the person if there was any ridiculous symptoms? Pain, numbness, tingling, other sensations shooting from the back down to the legs or the neck down to the arms. Oh, my report is silent, which means I asked it and it was denied. There was no mention of ridiculous symptoms, or he didn't volunteer that information. Well, then we go and look at the questionnaire that people fill out prior to their IMEs, and what does it say? Hey, I have pain in my legs, pain shooting down the back of my hamstring, tingling in my toes. Well, doc, why didn't that make it into your report? You said he never told you, and it's clearly in the questionnaire, or did you just happen to leave that part out? It happens a lot. There's often a huge disagreement between what the IME doctor says and what your treating doctor says, and the insurance company knows that if the IME says that you have no disability, no ongoing disability, no permanent disability, they have an excuse to cut off your checks. And whether it's denying your claim entirely or limiting what you can get out of the insurance company, they're going to use that opportunity. And your MRIs are not always going to save you. The insurance company is going to use those against you. Most people over 40 have disc bulges, have some positive finding in their back without ever having pain. And insurance companies will twist this around to say that your injuries are pre-existing. They're going to argue that the MRI doesn't prove anything because it's normal for your age, it's your normal wear and tear. So without a doctor linking your injury and your disability and your MRI findings to your job, to your accident, to your repetitive stress, they're going to deny. So it's important that you have a good doctor who knows what they're doing and how to link it all together. Gradual or repetitive stress cases are even more difficult. Pain that is built up over time, repetitive lifting, bending, twisting, injuries that are specific to your work that you do all day, they're going to say it's not work related. They're going to ask whether it's social or medical history. If you play any sports, what are your hobbies? What type of things do you do outside of work that could have caused these? They're going to try to shove it off onto that. These repetitive stress cases need a very strong medical history to be successful. If you wait to mention that you have a back injury, even by a few weeks, they're going to deny it. They're going to say it's a new claim, new injury, new problem. Any delay, even minor, they're going to say, well, if your injury was so bad that you can no longer work, why'd you wait all these weeks to file your case? They're going to use that against you, even if you still fall within the statute of limitations. In addition to all that, there's a built-in deadline in back cases that can quietly wipe away a huge part of your awards and your settlement. It's the 130-week MMI presumption, called 15-3W, and this really hits back cases the hardest. After 2.5 years, on the 2.5-year anniversary of your accident kicks in, this presumption basically says that unless there's a finding you're not at maximum medical improvement, any compensation beyond that date, the carrier gets to take credit for against your permanent injury award. If you've been classified at the 155-week mark as having a 50% permanent disability, disability, and that entitles you to 300 additional weeks of compensation. The insurance company is going to take credit for 25 of those weeks because they paid you 155 weeks, 25 weeks more than the 2.5-year mark. Instead of going 300 weeks, your benefits are only going to go 275 weeks. They're going to get cut short 6 months early. And if you're not careful, they're sitting there paying you with one hand and taking credit for it with the other hand. Oftentimes, if the insurance company can't wrap your case up quickly, they're going to try to let this case drag, get a finding of maximum medical improvement as soon as possible, and push so they can take credit for the payments they've already made. What's the bottom line here? Back cases are not impossible. They're very doable. You got to do them right. They're easy for the insurance company to attack, and you got to know what's coming so you can defend yourself and get the benefits that you're entitled to. You need strong documentation, you need consistent treatment, and you need the right legal strategy. When it's handled correctly, back cases can lead to really high awards, but you have to protect your claim early. I'm going to reveal how to do that and how you can get a big settlement in just a second. What mistakes can ruin your workers' compensation back injury case? Not reporting all your symptoms right away. If you only mention low back pain but leave out leg pain, numbness, hip pain, shooting pain, the insurance company are going to say that those problems are not part of the case. People will leave out things. They'll say, well, I hurt my back. They'll ignore the fact that they have a shooting pain down their leg because it won't make much sense to them. Guess what? Tell everybody about it, because you might not know the interaction between the nerves of the low back and the leg and how an injury in your back could cause pain in your foot, but the doctors know. And if you don't mention it, you're not helping yourself. Make sure you write it down on the questionnaire. Make sure you tell the doctor. Make sure it's clear. And if you don't see it in the report, tell your lawyer about it. Once they separate out your injuries, they're only going to accept a small part of what they think is related to your case and try to deny all the rest. This is one of the top reasons that back cases get denied. Missing early diagnostic steps. Back cases often need MRI, EMG, diagnostic tests, not just an x-ray. An x-ray is not going to show what's wrong with the soft tissues, the nerves and the discs. MRIs are what are important, and EMGs are nerve conduction studies. They could tell us if a neck disc is causing problems in the hands and fingers. They could tell us if a low back disc is pressing on a nerve and causing an issue in the feet and toes. The medical notes must show the right symptoms first. The doctors cannot just send you out for an MRI because he wants to send you for an MRI. There has to be a reason for it. So make sure the medical records are clearly document all the symptoms that you're having that justify the need for that MRI. If the early notes don't show leg symptoms, weakness, radicular symptoms, shooting pain, numbness, the insurance companies are not going to give you authorization for that testing. And when the testing does get blocked, they can later argue there's no objective evidence for a back injury. Waiting too long to tell your doctor about back pain is a mistake that can ruin your case. You fell down a flight of stairs, you broke your arm. The bone is sticking to the skin. The nagging pain in your low back and your neck might be the last thing you really care about at that point in time. But if you are having pain, make sure you tell them. Do it as quick as you can, even if it's minor, because waiting is going to hurt your case. Even a few visits where you don't mention your back gives the insurance company ammunition to fight the claim when it does come in. Back cases rely very heavily on consistent early documentation. So tell every doctor that you're seeing about your back symptoms at every single visit. If giving shorter, incomplete stories during your first medical visit or during your first visit with your lawyer, no good. If you say, I'm not really sure what happened, or it didn't really hurt that much at first, they're going to use that against you if it's in documentation. You need to be clear about the motion that caused your injury, the lifting, the bending, the twisting. We call it mechanism of injury testimony. And when the mechanism of injury is unclear in your claim or in your medical reports, oftentimes they're going to deny. The judge is going to say, hey, you're claiming that you hurt your back. How did you hurt your back? And if you couldn't tell me a week after the accident happened, what makes you think you're going to remember enough to tell the judge what happened 6, 8, 10 months later? So talk to your lawyer, talk to your doctor, lay it out on the table, make sure we're all on the same page. Be consistent with your story from the start. Inconsistencies are killers. Not explaining how the job duties actually caused your back injuries. And this is more important when it comes to those repetitive stress. We call them OD, occupational disability claims. If it's a gradual injury, you must describe how that repeated lifting, bending, or twisting, or climbing. How did your job cause this injury? Tell your doctor, I lift 50-pound bags of feed off a conveyor belt and I transfer them to a pallet. And all day I lift, I turn, I bend. If you have documented injuries that are consistent with those motions, then your doctor knows about it. His report's going to be strong and we're going to be in a good place. Doctors need detail in their notes, or the carrier can say that your conditions are not work-related. Not understanding how dangerous an IME can be and failing to prepare. Back IMEs especially, they're quick. They could leave out key symptoms, key information, key aspects which are very important to your case. If an IME says that you have a mild strain, the insurance company is going to use that to reduce your benefits, cut you off completely, controvert your case altogether. Remember, IME doctors work for the insurance company, not for you. Make sure you prepare with your lawyer in advance so you know exactly how to handle the examination. Be open, be honest, but keep it simple. Don't talk too much. Answer what's being asked of you and move on. Not reporting new symptoms quickly. Back injuries commonly lead to issues with other body parts as well. Hips, knees, ankles, the opposite leg. We call these consequential injuries. You have a much better shot of them being being affirmed and having your case amended to include those additional injuries if you do it quickly and you stay on top of it. If you wait, you're going to lose them. These consequential injury can significantly increase the value of your case as well, but only if they're documented early and your case gets amended to include them. Final mistake that we see it happens all the time, it's construction worker syndrome. They downplay the severity of their injury. It's the tough guy mentality, and I get it, but people downplay their injuries. They don't want to seem dramatic. They don't want to seem like a crybaby. They want to move on with their day. They skip these details and they try to look tough. The insurance company loves it because they just got away with not having to pay a single dime on a case. And maybe if that injury progresses into something worse, well, you didn't file, you missed the boat, you never gave notice to your employer, it's as good as gone. And it's a case that you could have gotten money on. You could have gotten a settlement on because you're entitled to because you got hurt on the job. What should you expect with treatment for a work-related back injury? Treatment for back injuries moves slower than most people expect. The doctors have to follow the medical treatment guidelines. The doctors have to follow the PAR process for requesting authorization. And if they don't, you're the one who suffers. And the medical treatment guidelines here in New York State control what you can get, when you can get it, how long it lasts, the number of therapy visits you get. Everything must be medically necessary and show functional improvement in order to proceed. If their paperwork, if their requests, if their documentation is not worded correctly, the insurance company will use that to block care. If they don't follow the rules to a T, not only will they deny, sometimes they will ignore a request for treatment. Imaging doesn't happen right away. Most people don't get an MRI in the first few weeks unless there are huge red flags like severe weakness or bowel and bladder dysfunction. But you've got to go through the guidelines, and when it's time for an MRI, it's time for an MRI. Insurance companies are going to use the treatment guidelines as an excuse to say you should go try your conservative care first, and only when it fails can you move to the next level. And the same goes for your injections. You have to try your conservative care first. Your medication, home exercise, you can't jump right to injections. An injection has to show meaningful improvement and not just pain relief, so it's got to show functional improvement. If the first injection doesn't help, they're going to use that as a basis to deny future injections, and the approval process alone can take weeks and weeks and weeks. This frustrates the injured workers out there who want their answers early, but unfortunately, that's how the system works. Here's a practical tip for you. After an injection, tell your doctor exactly what you experienced, how it changed your mobility, how it made you better to whatever degree it did, so that he could use that to try to get authorization for any future ones that he might need. Physical therapy is limited and has to show progress. Usually, you get around 6 to 12 weeks of physical therapy to start, and if your doctor doesn't document functional gains, they can start denying and limiting future requests. So make sure the physical therapist writes down all the changes and the doctors document any improvements so that you can get additional physical therapy if it's been helping you. Surgery usually isn't considered until well into around 6 to 12 weeks after the injury. There must be nerve compression on an MRI. Symptoms must match imaging for you to show that conservative care didn't help, because back surgery is a big decision and the system wants to make it hard to get it quick. Denied treatment is a normal part of a back case. Many of the denials are not based on medicine, they're based on the treatment guideline and technicalities in the guideline. Your doctor and your lawyer have to fight these with correct forms, correct language, correct submissions, and requests for treatment. Treatment delays can also affect your checks. If the insurance company blocks your treatment, they're later going to use that against you. They're going to say, there's a 6-month gap in your treatment. And you're going to say, yeah, you didn't authorize my treatment, so of course there's a 6-month gap. You still have to see the doctor. Here in New York State, you have to see the doctor once every 90 days to maintain ongoing awards for lost time. So I don't care that they didn't authorize your physical therapy. I don't care that they didn't give you your MRI. I don't care if you were still waiting for authorization on your surgery. If 90 days, 3 months are getting close, you better go see that doctor, get a report in there documenting your level of disability, what he's recommending, what the current status is, so you can keep your benefits going. Those treatment delays, if there's no medical documentation of an ongoing disability, will impact your benefits. Denied therapy can lead the IME doctor to say that you're at MMI. Well, this guy, he hasn't been back to physical therapy in 6 months. He must have been at MMI. That's why you should still see your doctor, make sure it's documented, and make sure the doctor is there to support you, because he's going to testify as well. How do you get big money on a back case? Your back injury is a non-scheduled loss of use case. Spine injuries don't pay based upon a percentage of the body part like a knee or an arm does. They're paid based upon your loss of wage earning capacity and your lost time. What does that mean? You have to be out of work or working at a reduced salary in order to receive ongoing benefits. This means that your job, your skills, and your ability to work matter as much as the injury itself. Your disability rating when you have a back injury depends on 3 things: the physical damage to the body part, what the MRI findings show, surgery, nerve studies, the medical records, functional limitations, things that you can and can't do anymore, your limitations on sitting, standing, pushing, pushing, pulling, banding, sitting, walking, limitations on activities, your vocational factors, your age, your educational background, your job history, your work skills. So those factors do come into play at the time of permanent disability. Reporting all the symptoms early helps increase the case value. Nerve symptoms lead to higher impairment rating. It puts you in a whole different category. The earlier you get them into the medical, and the harder it is for the insurance company to fight their existence. Consequential injuries make your case worth more. Back injuries often cause problems in the hips and the knees and the opposite legs. These extra body parts, if they're brought in, will count towards your overall level of disability and increase your case value, but only if they're documented early and accurately. Surgery can significantly increase the value of a back case. They show how serious and long-lasting the injury is. Workers with surgery often get higher settlement. I'm not saying go out there and have unnecessary surgery, but if your doctor's recommending surgery, give it some serious consideration. Staying out of work for the right reasons can increase the final award. If your doctor keeps you out of work because you physically can't perform the job, it shows that you have a high level of disability. But you need clear medical reports and medical explanations as to why that is. Gaps in work must match the medical evidence. If you lose time from work, make sure you see a doctor. Returning to light duty work too fast can reduce your case value. If you go back to full duty without restrictions, the insurance company is going to argue that you have no disability. If you go back to light duty and you earn close to your old wages, they're going to argue that you haven't lost any wage earning capacity, so you're not entitled to benefit. Always match your work status with what your doctors say that you can and can't do, because that's what they're going to testify to when the time comes. Getting permanency at the right time is crucial. You have to strike at the right time. A strong lawyer can dramatically increase the value of your back case. They know how to fight for what you're entitled to. They avoid what's unimportant. And they know how to beat the insurance company at their own game. Make sure all those body parts are included. We get to fight the IMEs that are trying to push you into MMI early. We build the evidence that you need to fight for a higher disability rating. And we know how to avoid the traps that are going to get you the payout that you deserve. That's why you need a good lawyer. Somebody like me, for instance, Rex Sikotsky, 212-406-8989. I love you guys. Have a great rest of your week. Don't forget to like the video. Don't forget to subscribe, and we'll see you guys soon. Thanks so much.